Treatment with antibiotics can destroy not only harmful bacteria, but also useful. However, probiotics help restore intestinal flora, insists their ubiquitous advertising. Probiotics actively advertise as a remedy for various problems, from obesity to mental disorders. But most often they are recommended to restore the intestinal flora after a course of antibiotics. The logic is simple. During treatment of infection, antibiotics kill all bacteria, both harmful and helpful, so the intestines need to colonize new bacteria. However, the effectiveness of this method is not practically proved. Moreover, the researchers found that the use of probiotics after the antibiotics actually delays the recovery of the intestinal flora. The problem is that sufficient research on any particular probiotic just isn't there. Even when the researchers used strains of live bacteria, the composition of the cocktail can vary greatly in different laboratories. This is the opinion of the Dan Newberry from the Rand Corporation, who in 2012, analyzed a large database regarding the use of probiotics to treat diarrhea caused by antibiotics. Newberry did a review of 82 studies involving 12,000 of patients as a whole. He came to the conclusion that the use of probiotics really helped to reduce the risk of digestive disorders, but to figure out which probiotic or mixture of probiotics to be effective, it is impossible. Recently, scientists of the Institute of Sciences Weizmann in Israel proved that even in healthy people, the use of probiotics after the antibiotics were not so safe. One group started taking probiotics, the second part took nothing, and the third had the transplant feces. Members of this group received the stool sample they took from them to the antibiotics. The result was unexpected. The worst result was from those who took probiotics, and the best, the cohort that received a transplant of fecal matter. Only a few days intestinal microflora they have fully recovered. However, despite these findings, the demand for probiotics not only not diminished but growing. In 2017, the market for probiotics has made more than $1.8 billion. Until 2024, it may grow to $66 billion. Given the scale of production, it is very important that the use of probiotics has been duly proven, says Erin Elenev of the Weizmann Institute. This is also the reason that regulatory bodies, such as the American Management under the Control over the Quality of Food and Medical Products and similar European institutions have not yet approved the clinical use of probiotics, as the scientist. Exploring the genes associated with the immune system, scientists were able to predict will be the patient's intestines are susceptible to colonization with beneficial bacteria. They will simply walk on by without stopping. When you take a tablet of paracetamol, you're more or less sure that its active component will act on the receptors of your brain and reduce the feeling of pain. Because the mechanism of pain in most people is about the same.